Good morning. Welcome to the Medicare Show. I'm your host and Medicare advisor, Jeffrey Kuhn. This morning's episode, which is currently going to be, recorded, I should say, on October 28th. We're not even at 7 o'clock yet here in the morning, and this is based on information and discussions I've had last week. The second recording of this one, I was just mentioning on the other podcast that I sat and did a couple shows this morning and realized didn't have the audio on recording. So we're redoing this one. There's letters that went out last week, and every week I talk to a number of different insurance agencies, insurance agents, about things that come up, and I get calls all the time with questions. One of the things that came up this past week, which everybody felt a little bit, I'll say, distraught about, that this information was not publicized out there to different agents that use United Healthcare. And people got a letter. They want to know, what does this mean? This is around fitness programs. And I will tell you, over the 10 years that I've been involved exclusively in Medicare, I've realized how important these benefits are to people. Not everybody. But there's been groups of people that utilize, it's called silver sneakers. People remember that. There was clubs, there's groups of people that would get together that belong to different gyms, and they would utilize these benefits and work out together. And I always get asked, do I get the free gym membership? People ask about that all the time. And some people, it's not important, but for those of you that are into fitness and use this is something you really need to pay attention to. There's going to be a significant change next year, I think, with a lot of the gyms that people are using, and you need to be aware of this, because I know we're kind of now into the second week of the annual election period, and you've got till December 7th if you're utilizing Medicare Advantage plans, or if you're using supplemental plans that may offer these benefits. You better start doing some research on this one. I'm going to read you the letter that clients got that are with United Healthcare, and I'm going to tell you what it means. I'm going to tell you what you need to know. And its subject is 2025 Renew Active Fitness Program Network Update. Dear valued member, as part of your current United Healthcare Medicare Advantage plan, you have access to Renew Active, your fitness program for body and mind. It comes with your plan at no additional cost. We're reaching out to let you know about an upcoming change to your fitness program network so you can continue to enjoy this plan benefit. Starting in January 1st in 2025, some gyms and fitness locations you visited may no longer be in your Renew Active network. We're confident you'll find a participating location to help you remain active either at a gym or from home. With continued access to a large national network of over 17,000 gyms and fitness locations. To find a participating gym or fitness location that will continue to be in your Renew Active network, follow the steps below. One of the things it mentions is to find a gym or fitness location by logging in to your member site and go into health and fitness and health and wellness and select fitness. You can scroll and browse gyms near you. You type in your zip code. And one of the things that it says in here that I want to make sure everybody's aware of is it says gyms and fitness locations listed as a premium location will not be in your network starting January 1st, 2025. This is what you need to pay attention to. I believe a lot of the gyms that people are going to are considered premium locations, and I'll give you two really good examples. One, certainly up in Western New York, they have revamped all the YMCAs. They're absolutely beautiful what they've done to them. Pools, the fitness centers are fantastic. They've got classes. A lot of people, I'll say most people that we see are using those facilities, among others. Those are considered premium locations. Now, I've heard there are a couple YMCAs out there that are not a premium location, but those are probably the ones you don't want to go to. Very basic, crude YMCAs they probably haven't updated, but there still are some that are not considered a premium location. And a good friend of mine and I were chatting this past week about this. We're talking about Virginia, Maryland. I used to live down there, and him and I used to work out together at Lifetime Fitness. And he's like, oh my God, Jeff, Lifetime Fitness is on that list. They're no longer going to be accepting United Healthcare's fitness program. And that's huge. I mean, it's a great facility. I know that those locations are not inexpensive. They're down all the way in Florida. So for folks in Florida, Lifetime Fitness, I mean, they're gorgeous places. They're great places to work out. And they're no longer going to be accepting your Medicare plan for free gym memberships. The cost of this to absorb it, when you look at the YMCA's up around here, and they're on, I will say, for the nice ones compared to Lifetime Fitness, they're very inexpensive. We're talking $70, give or take. Some for an individual membership, family memberships are obviously more. I know that Lifetime Fitness is typically in the hundreds of dollars. And this is, part of the cutbacks that are happening. And it's coming in two ways. Number one, Medicare is reducing some of the money that's being provided to these insurance companies. And I've saw the number posted of 0.02% per year. Over the next 3 years, there's going to be a reduction in reimbursements to these Medicare plans. And the other big one is the Inflation Reduction Act. There's a lot of things in the news about people saving money. Reuters had posted an article specifically about Medicare plan, Part D plans, and Advantage plan premiums are going to decrease for 25, and that's just not true. I went through the area and looked at all the Part D plans, and most of everyone jumped up. Most, not all, but most every plan jumped up a significant amount for next year, and a large part of that's due to the 5% that the insured would have to cover when they're in catastrophic. That now has to be absorbed by the insurance company. So you've got a couple things working here. All the plans I've seen have really reduced, in some respect, benefits and an increase in cost sharing. So you want to look closely at your plans. Don't just look at the premium and the copays for primaries, for specialists. You got to look at the stuff that matters. If the gym membership is important, that's one of them. You should look at diagnostic imaging, outpatient, ambulatory surgery, x-rays. Seen some plans that are sneaking in 20% coinsurance that used to have copays. So the gym memberships I know are important. Don't ignore other areas. If you have Blue Cross Blue Shield, any other insurance company, they do have their own fitness programs. And you can go online and look and find out if your gym is going to be accepted or not. You don't want to get a surprise come January. So we know a lot of people are going to be surprised with the terminating plans if they don't pay attention. And they're going to end up with just original Medicare, no prescription drug coverage. That's a whole different thing. But we want to let you know this. I know gym memberships are really important, and hopefully you found this information useful. I want to thank you for joining me on this podcast. If you've got any questions, feel free to call. Our number is 585-283-2553. You can also email us at themedicareshop@gmail.com. So please, if you don't mind, subscribe to the podcast if you found this information useful. Share it, and certainly make any comments. We appreciate any feedback, or if there's anything else you'd like us to do a podcast on. Thanks for joining me this morning. Take care. Bye-bye.